So today we're going to learn how to determine how to read your strips and whether it's AFib. So first thing you do is to see if it's regular or irregular. How you can tell that is by looking at the distance between the R to R and if they're equally spaced. As you see, the R to R is not equally spaced. And you can also tell by looking at the P waves, and there's just so many little P waves that they're not equally spaced either. So then you know that that the strip is irregular. Now we try to figure out who to blame. Is there something wrong with the atrium? Then there would have to be a problem with the P waves, which in this case, that's what it is. If there's something wrong with the ventricles, the QRS would have to be greater than 0.12, and in this case, it's less than 0.12, so there's nothing wrong with the ventricles. So now, since we determined there's something wrong with the P waves, we have to figure out if it's an A flutter or if it's an A fib. If it's an A flutter, it would be the P waves would be like this. For A fib, they're more little shaky. They're like quivering. There's like a bunch of quivers and like multiple P waves. For this case, it looks more like the atrial for AFib, which is afibrillation. So after we determine that, you could also look at the rate. And how you look at the rate is by looking at the R waves. And you have to look at it with the 6-second interval. So from here to here. So you count the R's: 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. And you multiply it by 10, which would be 110. And that would be your rate. And that is how you can tell if it's an AFib.